What are the most common signs of brain damage in a newborn baby? I'm going to talk with you today about 5 areas of concern that parents share with us when their baby has suffered a traumatic brain injury at birth. And this is generally an HIE injury, hypoxic ischemic encephalopathy. Either these babies have went on and suffered this injury or been diagnosed with an HIE injury, or doctors are in the early stages trying to rule out a brain injury. And these things are coming up and they are concerns for doctors and medical professionals. The first one that we always hear about is seizures. A lot of times these babies have suffered seizures. And for our definition, seizures are going to be abnormal brain activity. Seizures can occur, they can occur, and for some newborns, it's immediately right after birth, or sometimes what you can have is the seizures may manifest themselves a little bit down the line. The baby may be in the NICU or getting treatment, and a seizure or seizures begin to show up. So number one would be seizures. The second thing that families talk with us about is the baby needing oxygen. For a lot of these families, the babies will have poor oxygen effort and they will need to be resuscitated and given oxygen. So oxygen is something that comes up a lot. That's number two. Number three is when the baby is blue or discolored. And generally when the baby is blue and discolored, what also accompanies this is the baby being floppy, or the parents noticing that the baby seems to be floppy when being handled by the medical professionals or even the family for that matter. Number four is needing to be put in the NICU, a NICU handoff. When a baby has suffered a traumatic brain injury, or when a suspected brain injury has occurred, a lot of times the doctors will have the NICU already ready. This could be because maybe they saw something in the electronic fetal heart monitor readings that was concerning, and the doctors wanted to have the NICU on standby, or maybe there was meconium that was present, and the concern was whether that meconium had went down below the vocal cord. So the NICU being involved is also something that is reported by families who contact us regarding their baby's traumatic brain injury. And number five, hypothermia cooling. Hypothermia cooling is something that is being used more and more for suspected brain injuries for babies. There is protocol that is generally in place for when a baby should be put into the hypothermia cooling unit. Now, the hypothermia cooling is something that parents really have to understand, because there can be some confusion with the hypothermia cooling. Hypothermia cooling is not a cure for a traumatic brain injury. That's not what it is. In layman's terms, what it is that hypothermia cooling is there to try to slow the injury down, or to try to prevent the spread of the injury. The injury has already occurred, so it can't go back and fix, so to speak, the injury itself. It's just there to, again, try to slow down the spread of the injury itself. So these 5 areas, these are the most common things that come up when when a brain injury is suspected, or when a baby has went on and has gotten an HIE diagnosis. If you have more questions, maybe you're here today because your baby has suffered a traumatic brain injury like HIE, and you have questions as to the cause of the injury. Maybe you want myself or my law firm to do what we call a birth injury investigation to help you be able to determine the cause of the injury. What I invite you to do is go ahead and pick up the phone and call me. There's a telephone number down below on the screen. You can call my office and get on our calendar, and that way we can talk with you about the next steps or about your concerns as to the cause of your baby's traumatic brain injury. Make sure when you talk to my secretary that you give them a date and a time for us to be able to call you back. That is important. So like I said, we'll know when to call you back. And remember, it costs you absolutely nothing to initially talk with us about your baby story. One more thing before I get out of here. I practice law here in the state of Maryland, and I know from time to time I have individuals that will contact my office. They're not in Maryland. They are in the United States, but they're not in Maryland. Just understand that if this is something that we think we can assist you with, that we have to use co-counsel or local counsel. In other words, an attorney in your state if you are not here in the state of Maryland. But I just want to make sure that you understand that co-counsel or that local counsel aspect of things. All right, that's going to be it for today's quick educational video. Again, I'm Marcus Boston, and I'm one of the childbirth injury and medical malpractice attorneys practicing law here in the state of Maryland at Boston Law Group, LLC. And we'll talk with you next time. Take care. Enjoy the rest of your day.